Welcome to the Friendly Moms Club podcast with Jen and Karlee. We're the new mom friends you didn't know you needed.
We are creating a safe space to bring moms together, lighten the heaviness, and find joy in the everyday moments. Together, we will share our own experiences of being new moms while navigating the topics we wish more people talked about.
Join us every Monday to hear us skip the small talk and dive right into the uncomfortable.
Hello, good morning. Happy Mom Day, Karlee.
Happy Mom Day, Jen. Is it a beautiful day? Not for you.
It is
You're
actually.
sick.
It's a very beautiful day.
It's nice out.
Yeah, if you this sexy voice I got going on is just the end of a cold for me.
Phoebe Buffet would be very, very jealous. They would.
Peyton had a pediatrician appointment this week, and so my husband took her, but then they called me so that I could still be in the appointment.
Yeah.
And the pediatrician on the phone, he's like, "Didn't you know moms aren't supposed to get sick?" And I was like, I know. Tell that to my body because this is ridiculous.
Exactly.
But
How rude.
He was very funny about it. I know. I was like, I just get my body on board, please.
I got sick a lot when I first had Henry, and I'm not somebody who gets sick often, and I was sick every 2 weeks for months, and it was awful. So
it's so frustrating when you're trying to parent. We have a toddler who has lots of energy, a baby,
I know, you're
and
not
then here
sleeping.
I am just completely wiped.
Yeah.
And I had the weirdest symptom, and I'm gonna talk about it because it's so weird. And I was Googling it, and I'm like, I've never had this happen before. My taste buds on my tongue got inflamed.
Oh,
so the very last row of taste buds. And apparently this can happen from stress. Mm-hmm. It felt like I was choking. It felt like I had something in the back of my throat, food stuck. Mm-hmm. And I couldn't figure out what it was. And then I finally got an ad to look in there. And anyways, I had these big ass bumps, and it was all swollen and inflamed. So, that's fun.
And you probably lost your taste then with that.
Well, I didn't really notice a difference, but it's the very last row. So it has to be specific tastes, whatever, because the other 3/4 of my tongue was fine.
I don't think that's sweet or sour. So who knows?
It's the first 2/3 or something. And then this
those are the not important ones.
I don't know. It was just super weird. So I told my therapist yesterday, I'm like, my body hates me. I'm getting these weird, stupid stress symptoms. Who gets their taste buds swollen? That's just weird.
It is weird.
Anyways,
but motherhood.
Fun fact for you all, this can happen.
Does
Your
weird
tongue
things.
can get swollen.
Lots of things get swollen in motherhood, unfortunately. It's an odd experience, but we had all the stars aligned to record this morning. I kept Henry home from daycare because we're going to go to the park today, and I was texting Jen. I'm like, hey, give me a 5-minute warning so that I can put dinosaurs on so that I can sneak upstairs. So he's downstairs. I didn't even give him a snack, actually. I was going to do that too. But he's playing with his dinosaur stickers.
Throw some cheese on the ground.
Yeah, right? Got his dinosaur stickers and his dinosaur show on YouTube. So he's probably stay up there forever, lady. Doesn't care. So hopefully, I told Jen not to tell me, to not let me forget that I have a child because I can get in the zone.
I know, right? It's a day that normally he would be at daycare. So it's easy to be
yeah, what child?
Oh, yeah, it's just
So we're going to have a quick intro today. But before we pop onto the episode, let's quickly do a mom win and a mom whoopsies. So this week, my mom win is that we are switching daycares to a daycare that is closer to home. So Jeff and I have been crying all week because we love our daycare so much and we don't want to switch, but we've been trying to get into, I've been on the wait list for this one because it's literally up the street since I was pregnant. So 2 years now. And this is the first full-time spot that we've been offered. And we made a pros and cons list. The pros are significantly longer. So we've made the swap. Well, we're going to in September. So it's a little bit of a win because I'm hoping that one day I can go on mat leave again and then I can walk Henry to daycare, which would just make me so happy. That would be so nice.
It just makes,
it makes sense.
It makes practical sense for the move. It's just the emotional, really shitty part
definitely
of having to switch because really what makes or breaks the daycare is the people,
the staff,
the teachers
and the
that are
kids,
there.
And
you love them. So that's really hard to leave, right?
Yeah, and I had to tell them this morning that he's not coming, and I was so sad, but they're very understanding, and they get it because they're like, you got to do what's practical. And my mom whoopsies is that it's 9:04 a.m. and Henry is still in his nighttime diaper because he doesn't like to change before he eats breakfast, even though it's filled with pee. He's like, I want to eat breakfast. Don't touch me. So I fed him breakfast, and then I was like, hey, well, we're going to go record in a few minutes, and I don't want to piss him off because it's always a whole adventure. So I was like, you know what? He's happy. So I'm just going to leave him in it, and then I will go pester him now when we're done this. So 9 a.m., 9:04, really. What about you, Jen? Any
my mom whoopsie was that we were watching. So I put Peyton to bed, and that's our baby. And we had just been like snuggling on the couch watching Bluey with Jordan. And Peyton had made some noise, but we were gonna like see if she put herself back to sleep. And so we were just like kind of letting it happen. Like it wasn't anything crazy. A few little cries. And then all of a sudden Jordan got up and walked away, and we didn't think anything of it. And next thing we knew, she actually opened Peyton's bedroom door and started climbing up the crib. So then she really woke Peyton up. And then Annette and I didn't know, like we were just like, oh, she's going to go get a puzzle, or like she's going to go do something. And then nope, she wanted to go check on her sister, which is very cute.
It's very
but
cute.
Then now Peyton's very awake, and I was like, oh, you're not putting yourself back to sleep now.
No,
and so
no, it's a party.
Should have paid more attention to that one, that she was going down the hallway.
That's
but
a whoopsies.
we were just like tired, right? So we were just like, she's just playing. Like,
yeah. How cute would it be?
Didn't put any more thought into it.
Crawled into the crib and then they just snuggled.
Oh, she tried. She just couldn't quite get her leg up high enough. It would have been very cute.
We'll work on it. Yeah.
And Mama win of the day.
Well, you survived a week being sick, so I think that's a win. Yeah.
Yes. And just the fact that, I mean, I posted about it on stories, but I was running late to therapy and I was very stressed, and I don't like being late. That gives me a lot of anxiety. But I was just like, you know what? I really need coffee. She really needs to go to sleep. Like if I'm 5 minutes late, not the end of the world. Like it's okay. And all in all, I got to therapy. My therapist was late, so I wasn't even late, which is good. And I got Peyton to sleep eventually, and she just slept the rest of the appointment.
Perfect.
So I was very proud of myself for not like freaking, like part of me in the back of my head was like, just cancel the appointment. It's not going to work. It's all going to, like I just started having these terrible thoughts, but I got her to sleep. And I had a really good appointment, and I was very proud of myself for not letting it get off the rails.
That's great. And then you did it. You did the dang thing. You did the dang thing. So exciting episode today. We have Dr. Anna Burns. She's a pelvic health physical therapist. And then on top of that, she's also an ADHD coach. So she's a mom. She also has ADHD, and now she's coaching women to help them thrive in motherhood. So for myself, this is very relatable because I was diagnosed with ADHD and mat leave. And then for Jen, she just really enjoyed learning because we've realized that like even if you don't identify with being neurodivergent or you don't know anybody that like you can think of that may have ADHD or autism, you likely do know people. You just don't know. So it's good to learn how to be kinder to them. And if this is you, kinder to yourself. And just it's good for us to learn about other people, right? That's kind of, Jen, what you were saying, how you felt.
Yeah, I thought it was actually really interesting to learn more about it because I don't have anyone in my immediate family or anything like that. And so recently you've been diagnosed, and I've actually had a few more friends that have been diagnosed like in adulthood. So in their like late 20s, 30s now getting diagnosed. And so for me to have a better understanding of what they're also going through and how I can help, and it like explains certain things. And I talk about some funny stories with Karlee in the episode, so we'll get into that. But even if you aren't neurodivergent yourself, like it's still super interesting, super important to listen to. And yeah, I think it's a great episode. So we hope you enjoy it.
We can be more understanding to other people and just, more compassionate and just kind of make things make sense. Because I know for myself, after I was diagnosed, I had so many like, moments where I was like, why do I do these things? Or why do I have outbursts? Or why can't I just, whatever. But now it makes sense. So maybe for some of your friends or family members or coworkers, you could just have a little more understanding. So why don't we pop on over to the episode and chat with Dr. Anna?
Yeah, enjoy. Hello, good morning.
Welcome to the podcast. Today, as we mentioned, we got Dr. Anna here. So Anna, why don't you tell us a little bit about yourself?
Sure. So my name is Dr. Anna Burns. I am an ADHD mom. Diagnosed, my son was born 4 years ago. And just after he was born, I started going, oh, yeah, no, this is a thing. Yeah. I had never known it. And I've been trained as a public health physical therapist. That's the doctor part. I practiced for many years. And then once I got diagnosed, I went, oh my gosh, I wonder how many other moms or women my age are dealing with this. And I just delved into it, just head over heels. And
Would
just
you say a hyper focus?
Yes, one might say hyper focus with lots of
yes,
squirrely owning your own business things. So yeah, I just jumped all in and just realized how prevalent this is and how little people are talking about it, but also how normalizing and kind of compassion giving it is. Validating to know that like, oh, this is why I do this. It's not a moral character flaw, right?
No, not at all.
So that's kind of my background. My son is now 4. I live outside of Boston, Mass. I don't know. What else do you want to know?
Love it. Oh, that's great.
Yeah.
And right now, are you working mostly doing your own business, or do you still do any of the physical therapy stuff as well, or kind of moved into
I do it a little bit if someone finds me, but I'm not out there putting it out there myself. So yeah, I'm doing coaching 100%. I do
awesome.
Group coaching. I do solo coaching. So it's a fun ride. I love both.
Amazing. Very neurodivergent thing to just do your own thing and have your own business, because you
Absolutely.
then create the world that works for you around you, right?
Exactly. Yeah.
Maybe to start off, do you think you could do a quick definition of ADHD? Just so
Sure.
that if people have never heard of it or don't know much about it, when they're tuning in, then they can get a quick rundown of it.
Understanding of it.
Absolutely. So ADHD is called Attention Hyperactivity. No, ADHD. Attention
Deficit. There
Deficit
we go.
Hyperactivity Disorder.
There we go.
And it presents very differently in women and men and girls and boys. And so we think of ADHD as the little boy jumping off the classroom walls, disrupting, can't stop talking, can't sit still. And those are typically the ones that are diagnosed so early. And then girls tend to present with this inattentive type. We tend to daydream, not totally listen, forgetful, but no one can see it. And so they don't realize it's happening and diagnose. So those are that's a very umbrella thing. Hyperactivity is one pillar, impulsivity, inattention. Those are the 3 main pillars, and they're also starting to talk about emotional dysregulation as the 4th. And so when I was listening to one of your recent episodes about mom rage, I was like, oh yeah, no, 100%. Like I understand what that is and why, right?
Yeah.
There's a misnomer in ADHD that it's a deficit of attention. It's not a deficit of attention. It is an inability to regulate it and sustain it. So if you're in a big, let's just say restaurant, are you able to focus on the conversation with the person you're talking to? Or are you also hearing this TV over the bar? Are you hearing everybody else? Because it's so hard. Everything's coming in as noise. And so our brains sometimes have a hard time directing the attention.
No blinders.
So you have the attention, you just are putting it on a million things at once, as opposed to the one that, say, a neurotypical brain would be like, okay, I know I'm listening to you. I don't care about the rest. Whereas, you have the same ability to pay attention. You're just paying attention to a lot more. Yes.
Like I always get bothered by like, I can hear a sound in the background or like the faucet's dripping. And it's like, other people are like, oh, sure, it might be there, but that's not what they're listening to. Where I'm like having a conversation, but I'm also thinking about something else. I'm looking at that man in the background. I'm listening to the faucet drip. I'm like, like the cat's meow. And I'm just like, all of this I'm taking in at once. So that's...
it's like sometimes our brain doesn't know what's background noise and not, and so it all just comes in. The other thing about ADHD is like not only the directing the attention, but sustaining the attention. So like you might be fine directing it, but then you get caught up in your own thoughts and you're like 37 thoughts later, because you just have a hard time just like staying with it. So they're kind of 2 sides to a similar coin.
For sure. That's why I have so many incomplete little hobbies and projects around my house that I start things and then just, or I'll
task initiation, task completion.
For sure. Yeah. So can you talk a little bit about how does ADHD show up in motherhood? Because most women were not diagnosed, because it used to be believed that more boys and men had ADHD or were neurodivergent. And now we're learning like, sure, that one way that it presents, but that doesn't mean women aren't experiencing it. Like you said, it's just different. So how can it show up in motherhood? Like, how do we see it?
Yeah. So I think there's one piece, which is like the becoming a mom. ADHD in women is exacerbated by hormonal shifts. And so a lot of times, like onset of puberty, childbirth, like you may not have realized you had it all along. And then your symptoms got exacerbated to the point where they became a problem, like bothersome. It can also happen within your monthly cycle too. And then perimenopause, menopause can also be another spike. And so it's not necessarily just becoming a mom. I mean, some of it is the hormonal shift, but there's also so many more things to pay attention to. And so part of the thing about ADHD is having difficulty with executive functioning. And that means like making decisions, planning things, being able to follow through steps in order, keeping on track of schedules. We get time blindness. And maybe you were able to cope with just yourself. And then now you have this other tiny human who you have to executive function for. And now you've got to make all of their doctor's appointments and make sure they're on time and they show up and that their forms are filled out, And so it's what we already were struggling with a little bit, maybe just under the radar, then can kind of just go over the edge. And so it feels like we developed ADHD.
Yeah.
But, ADHD can show up in, how cluttered or organized is your house? Are you able to get in those deadlines on time? Are you returning phone calls, maybe from the school or emails or whatnot? Maybe you're having a hard time dealing with your to-do list and figuring out what's a priority and what's not. And so all of these different things seem to even kind of increase once there are more people in the picture, especially ones that can't function for themselves at that age.
They need your brain too, which is
right,
hard because
exactly.
it's hard enough even on your own. And like before you have kids, depending on what happened in your life, you could manage the capacity, like your capacity could manage the demands that were coming at you. So even I know a lot of people struggle in like university or starting their new jobs, but then they find ways to cope and, whether they're masking or they're just coming up with lifestyle modifications, and then they have a child. And I feel like for myself, this is when I just like went over the deep end that like I could no longer function anymore. And I also just was feeling overwhelmed all the time and not enjoying anything because everything felt too hard. Like nothing was manageable, where before I could like power through, but I couldn't do that anymore.
And you probably weren't even realizing how many coping strategies you had developed.
Oh my God. Right? My whole world is systems. My husband is like, why do we have a laundry system and a system for everything is a system? Because that is how I cope. That's how I got through nursing school, was I had to make all of these systems, which I thought were just like hacks, like different life hacks to stay organized. But really they're like, I can't put my kitchen towels in a basket with my shower towels or my clothes, or I won't do laundry. Like I will never put it away. So like I have these little systems, and my hubby and I always joke about it, but now we're realizing like they were all just coping mechanisms, right? Which worked. They were good coping mechanisms.
Yeah. And I think women, especially as girls, society, like we're supposed to be like the quiet ones, the organized ones and all that. And so we find ways to fit into that box over time. And then, like you said, you kind of exceed your capacity. And, we spend so many more years than boys do internalizing this struggle and being like, what's wrong with me? Why am I? And I just must be disorganized, forgetful, lazy.
Yes.
And kind of we've spent so much time thinking that by the time we get to the diagnosis, it's both, okay, there's a reason. Great. But that's also so ingrained in you at that point.
For sure.
That trying to unwind it and being like, okay, this is what's happening, but you also are calling you grieve yourself. And you're like, oh, wow, I wish I had more compassion of myself when I was 20, when I was 15, when I was 10, which we didn't know.
Yeah.
Right?
Yeah.
So.
I can also see that if that shift happens, so say, childbirth gives you that shift that you're like, okay, and things start kind of, I'll say going downhill for lack of a better term, but I could see that you would self-blame and say, I'm a bad mom. Like, why can't I handle this? Exactly. Other moms are doing this and they're not having the same, like, why can't I just plan and get to things on time and do this for my child? And I can see that if you don't have a diagnosis, you probably just self-blame and think that you are really bad at being a mom. And then that just is the shame spiral. It goes and goes and goes. When in reality, your brain is just functioning different and you don't know that yet. You haven't No one's ever told you that.
Yeah.
No one's ever validated that you're not abnormal. Your brain just works differently. Like, you're not a bad mom. You're not, we just have to get you to figure out how your brain works and like how to move forward with that.
And we know our brain is different, but I always thought it was like wrong, that I had to like change it or fix it, until I fully accepted, no, it's just that it's different. It's different. It's not wrong. It's not bad. It's just different. Yeah.
It's just sad that if all these women aren't getting diagnosed till they become moms, that first year or two that you're waiting for a diagnosis when you've become a mom, you just think you're doing a terrible job. And instead of enjoying your time with your sweet child and like really embracing this role, this new job that you have, and this new, your whole new person, because there's enough that goes on in motherhood that if you have this whole other piece behind it, I just and like that's
sitting there Googling, trying to figure out how to fix yourself.
I mean, this I guess is exactly what you went through, right? That's,
and I feel very grateful that I was diagnosed about a year postpartum, or it must have been like 8 months postpartum. But from my understanding, and you can speak to this, is that a lot of moms don't get diagnosed until their kids get diagnosed when they're older, because then they start seeing all these things in their kids get diagnosed, and they're like, wait, but like that's me. You're describing me. So can you talk about that a little bit? I can't remember where I was going with this.
Classic. So like what about the parents who are diagnosed once their kids are old enough?
Yeah.
And that's exactly what happened to my sister. She brought her son in for testing because he was starting to have some difficulties. And as she was sitting there through all the appointments, she was kind of taking tally in her head, being like,
wait a second.
Yeah. And I never ever thought that I had ADHD, because I was a great student. I excelled in a lot of things.
Successful.
I seemed organized, but I always had this imposter syndrome, being like, oh my gosh, if anybody found out, Toledo. But she was in her 40s, 50s.
Wow.
Not 50s, 40s.
Yeah.
And just started putting those pieces together. But I think hopefully this will decrease over time, because right now women are the highest proportion of the population getting diagnosed. So I think once there's a little bit more awareness of adult women having this, hopefully there won't be that like, oh, there's a diagnosis for him, but why not for me?
Yeah. And maybe we'll shift that criteria to also include girls and how they present.
Exactly.
And even like I presented as a typical boy when I was younger. I was bouncing off the walls, couldn't stop talking, always kicked out of class for like just being a clown. And then as I got older, I think I started to become more embarrassed of that. So I started internalizing it, and it started being in my head, and everyone would just say, oh, you're hyper, you talk too fast, that kind of stuff. But I would internalize the like big, like little boy things, because I started getting embarrassed at it when I was becoming a teenager. And I'm like, oh, boys don't like that. I have to be quiet. But I fit the criteria. And I had teachers joke all the time that I had ADHD. And I even was like, oh, of course I do. And it wasn't until I was an adult, mostly when I became a mom, that I realized, okay, I do, but also it presents in all these other ways that actually affect me, and not just being like the hyper kid. Like you're talking about the time blindness and the task initiation. Like I remember I would pump every night before I went to bed. My hubby would do a bottle, and I would sit there, or I would be doing other things for an hour, just doing every other thing on my list. And he would be like, why can't you just sit down and pump? And I'm like, I don't know. I'm scrubbing the floor and doing the dishes and organizing this and calling these people. It's not like I'm just sitting there doing nothing. And all I had to do was sit down and pump, and I couldn't do it.
It's boring.
It's boring. You're right. It's so boring. I wanted that, that excitement. So it's interesting that like it shows up in other ways, not just being hyper, not just not paying attention.
Yeah.
And like you said, the emotional side of it too. It's a lot. Do you have any stats on the actual like prevalence of ADHD now, or like what's like the current research saying about how many, like what's the word?
I
don't know how frequent it is. What's common? That's the word.
When I was researching this for a presentation last week, the data I found was like 20 years old. So it's going to change. Yeah,
hopefully
from
soon.
there. But it was at that point. We'll talk girls first.
Yeah,
girls it was like 4.8%, and boys was like 13. So there was a big, huge difference, right?
Yeah.
And then when they talked about adults, it was much more like 5%, 4%. Like it was so much closer. I think because the women are going up, but also the boys have already been diagnosed, right? And so as adults, that's not a new
Yeah.
diagnosis necessarily, or they're getting, diagnosed not quite at the same rate.
Yeah, that makes sense. Okay, so hopefully that research, like in your opinion, do you think that men and women are pretty similar in how often it happens? Or like, I guess we'll find out. We don't know.
What I think is interesting is that with moms, I feel like we talk to each other all the time. We kind of crowdsource, right? And so I think there's a certain amount of like women being like, oh, I heard this person had it and that kind of sounds like me. So we talked about it and I was like, oh yeah, I should go get diagnosed. I think this is completely not scientific, but I think the men maybe are a little bit less likely to be like, hey, I'm struggling and let me find out how to fix it.
Yeah.
Got it.
I think a lot of times people when they get into career coaching, executive coaching, leadership coaching, I think that's where the men tend to be diagnosed.
Yeah. That makes so much sense.
Yeah.
I see this.
Like, how does your brain work and why isn't it working in this work setting?
Yeah.
Right.
My husband all the time and is like, you talk about X, Y, and Z with your mom friends? I was like, yeah, nothing is off the table. We will talk about anything and everything. And he's like, oh, we just talk about like sports and like, not even that. Like they just talk about very surface, like they just joke around and talk about very surface level stuff. And he's always shocked. He's like, wow, you guys talk about that? Or like, it's just always these random things. So you're right. They're not having these like really heart to heart, like, I find it hard to organize this, and do you guys find it hard if you have a to-do list and doing this, or they'll just make fun of things and joke about it but not seriously talk about those things.
That's a whole other problem.
And so you're right. But then a lot of men, if they're in high powered positions and jobs and they do this executive and leadership training, they might actually be identified like, this is how your brain's working. Like, if you want to be the best, you need to learn and understand how it works so that you can better be the best version of yourself, to be the best owner, CEO, whatever.
Yeah, exactly.
That's
so
very
I think
interesting.
there's a certain amount of that, because they're also like, guys don't go to the doctor very often, right? Yeah. And so they're not going to go to the doctor and be like, I'm finding it really hard to focus, right? Like they're just going to be focusing on some other health thing. Like they're going to be focused on whatever, oh, it's just a physical, blah, blah, blah. I always tell my husband, I'm like, well, did you talk about this? Did you talk about that? No.
Like, no. Yeah. I know. Got to send them with a list.
Right. I actually just go with my husband to a lot of appointments, and the doctor will ask things, and then she'll look at me and she'll be like, okay, and what do you think? And because he just won't say things. And I'm like, don't you want to tell her about what happened last week? And he's, oh, I guess so. And I'm like, no, you should tell her. Like, these things are important.
Yeah.
Right.
Yeah. And then do you think that more kids do actually have ADHD now, or it just is that it wasn't diagnosed years ago?
It wasn't diagnosed at the same rate it is now.
Yeah.
I also think that the criteria for diagnosis have changed somewhat over the years. And so I think more people are kind of falling into, I call it the neurospicy category, where it's like, okay, like something, maybe it's ADHD, maybe it's autism, maybe it's something else.
Or both, yeah.
So I think we're getting better at, at knowing what's going on and actually agreeing on what are the, what are the criteria for diagnosis? Yeah. Because it wasn't that way, 20 years ago. Like I tell a story where for me, once I got to college, I was having these, I call them spells, where I was like listening so hard at lecture, and you can see in my handwriting where my handwriting would just go in the trash. And so I got all this workup of neurological workup and whatnot. And they were basically like, no, you can't have ADHD, but you know what? Just drink a cup of coffee before class and I think you'll be fine.
Funny they say that.
Right. And this was like 2000. So just even that kind of awareness of like, okay, now we have different pillars that we're measuring by that are closer and closer and closer to the goalposts than you ever used to be.
So you were just like so focused on that one thing on the lecture, hyper focusing, that then you weren't writing properly anymore? Like that what was happening? I think it was more,
I was trying so hard to process auditorially that my brain was like, we can't do both.
Got it.
Yeah. And this was definitely before, this is before laptops and iPhones and things that record. So it's a very, it was a very different world, but that's kind of one of those like moments of like, there's some abnormal brain activity, but we're just not gonna call it anything.
Yeah, right. We're just gonna ignore it. Yeah.
Right.
I mean, it's probably good you didn't have laptops. I spent 90% of my nursing school lectures online shopping, looking up random things, maps.
Yeah.
I love maps. I was always looking at maps. It's my special interest.
Yeah. And when I went to PT school, everybody had laptops, which I thought was really weird.
Yeah.
And I sat in the back of there were 3 rows, and I sat in the back, and so I went to Duke, which is basketball, like NCAA basketball. So when March Madness happens, and I was amazed to see how many of my classmates were watching games on their laptops. And I was trying so hard to focus on what the teacher was saying and trying to write notes. And I'm like, how are you even learning anything? And it could have been that they just needed that stimulation.
Yes. 100%. Yeah.
To be able to do it.
Yeah.
And,
need
but
the
I was
both.
just like, how is anybody learning anything? Because
I
could see on everybody's laptops, it's clearly no one has the PowerPoint up.
What are the most common things that you hear from moms that you're like kind of that lead to the diagnosis, other than they're, identifying things about their kids? What are some things moms come and they would maybe tell you that you're like, okay, maybe that is ADHD, or maybe we should look into this further?
Yeah, I think back to one of my original clients, and she didn't have a diagnosis, but clearly after working with her for 6 months, it was like, oh, no, you do. And for her, it was like organizing her to-do lists, figuring out what was important. And she was someone who wanted to do all the things all the time. So like her New Year's resolution list was like this long. And then she would feel really bad at the end of the year when she didn't do it all. But she wanted to do all the things, right? And so she was having a real hard time like organizing her stuff, because she had all these different, sewing projects going on, and, this stack of cards that she got for birthdays that she never sent out. And so there's that piece of things, like the physical clutter. There is the, like, I can't find anything in my house. It's a mess. I don't want to have people over. There's that piece of it. There is the to-do list, which is like, I don't even know where to start. That kind of overwhelm. If there's so many things on this to-do list, I don't even know where to start.
Yeah.
Or I'll get the idea of there just aren't enough hours in the day. I don't know how to be a working mom. Like, I don't know how to do that, because I have zero time for myself, because everything else is taking up so much brain energy. You wake up with your kid and you fall asleep with them in bed at night because you can't get up and then go do laundry. Right. So there's a lot of that kind of that sort of thing. I know for me, I remember telling my therapist I had been on anti-anxiety, I had been on antidepressant, and we've been in therapy weekly for years now. But I just remember talking to her in the beginning, being like, I feel like I should feel better right now. With all the med changes, with all of this, life is still really hard. And not in a like I'm complaining way, but in a like, if anybody was working so hard up here, they would never have a kid, or they would never have more than one, right? Because it's just like my brain is going all the time, and I just don't know how to organize.
And everything feels so hard. What about the sensory stuff? Because before you have kids, you can kind of control your environment for the most part. You don't have to be around people who are screaming. You can just leave. You don't have to be around all these toys and other kids screaming. And then you have a kid and it's like, I can't control the noise around me. And it just happens that every single child's toy is the most annoying thing in the entire world. Do you notice that people all of a sudden are like really overwhelmed by sounds that they feel like they weren't before, but they were, they just could control it?
I've noticed that a lot in myself. Is like the screaming, or like my son loves like running around and yelling and I need to be like, dude, take it down a notch. Like, I can't hear myself think, and I'm not trying to say stop, but it's like, my brain can't handle it. And I'm very sensitive to things. The older I get, the more I understand. Like, I am very sensitive to sound. I'm very sensitive to light, and all this stuff, like blinking loud toys that don't have an off button or don't have a dimmer, like a
volume adjustment thing.
It's just like
drives you bonkers. And that's annoying for most people. It's not like if people are listening to this and they get annoyed by toys that they're like, oh my God, I must have ADHD. They're annoying for the general public, for everybody. But it's like it's like a cheese grater on the inside. Like,
that is exactly the word I was thinking of.
Instead of it being like, oh, that's irritating, you feel it inside and it's like, if you could see, you know? And
absolutely.
Yeah.
And so right now I'm actually at a house with my family for a reunion, and there are 14 of us from the age of 4 to 75. Exactly.
Yeah.
I love your action.
I'm like, yay, family time. And you're like,
Oh, goodness.
Like,
Yeah.
we just got here yesterday, and I'm already like being like, I need to go take care of my needs right now and go into a quiet room
Yes.
and peace out. Or like at home, I call it a nervous system reset. So if I've been with my son all day and my husband comes home, I'm like, I need to go lay in a dark room,
Yes.
horizontal, with my white noise machine on for half an hour. And it's not to sleep. Like, I can never sleep brains doing this. But it's just to be like, I need to calm down my nervous system. Because I think what happens is with some of the sensory stuff is we just live in this fight or flight, right? And so our nervous system just gets burned out very fast. And for me, like, that's one thing that I've learned that I need is just like, I need alone time, or I need power down, quiet time.
I used to always watch, I still love trashy TV, but that used to kind of be my escape, but I wouldn't even pay attention to it. And now I'm realizing it's not even that it was the TV, it's that I was like laying there doing nothing. So now I just go to my room and I close all the blinds and it's dark and I just lay there. And I my brain's not quiet. I'm not sleeping, but I'm not, I don't need the not the excuse. Like before I used to be like, oh, I have to watch a show. I can't just lay here. That's weird. But now I'm like, no, I can just lay here.
I can.
Like, I don't actually need to pretend I want to watch this right now. And sometimes I do, but sometimes it's like, I just need 10 minutes. On that note, what are so we talked a little bit about motherhood, the challenges of trying to do it all. Your demands change, your capacity is not enough for those demands. What are some tips that you have for moms things that can actually help when they're really feeling that overwhelm or organization
conversation with my group. There was a woman who was recently diagnosed in April, and she's like, I don't know how to become organized. Like, I don't know how to organize myself. And I'm like, stop. You can't organize yourself. That's too big of a task. There's no one system that's going to do all of that. And so really just breaking things down and finding out where you get stuck. And so for her, we talked about, she's going to a bunch of medical appointments. And so she says, I sit there and I write all these notes, just make sure I have what the doctor says. And then I don't know where to put them, and I don't know that I actually heard everything. And so we just said, hey, take your phone, voice record it. And that way you can sit and be present, knowing that you're not worried about writing and where things go. And you can always go back, but also asking your doctor to slow down, or maybe write things down, or draw for you, or some way that you process. And so a lot of times with my clients, it's a matter of figuring out, like, what is their little specific thing that we can make 1 degree course correction and end up in a completely different destination. And so it's finding those little tiny things, because I think especially as moms with ADHD, we want to do all the things, we want to do them perfectly.
Of course.
And if we can't do them perfectly, why even start? And so I think there's this fear of, I want to find just the right system to organize myself. I want to find just the right planner, or just the right calendar app, and it's really about breaking things down and saying, hey, what is one thing I need help with right now? And it's not cleaning my house out. Yeah. That's too big. Just find one little thing, because what happens is we get so stuck in this paralysis of task initiation, and we're already having a hard time with it, and we're putting these crazy expectations on ourselves, and it's not helpful. And so I think really, I kind of call it like microing things down as small as you can possibly get them, because if you're trying to make overwhelming adjustments to your lifestyle, it's going to backfire. Because let's be real, like, people with ADHD don't stick to things. We like to try them, and then we fall off the wagon, and then we beat ourselves up about not doing it right, and then we don't know how to start the next system. For sure. Right. And so there's just all the blame,
and it's like the poster child for ADHD is like having all of these grand ideas, these huge grandiose plans, and then you never actually do them or are able to. And it's not because there's something wrong with you. It's like your vision, it's like the equivalent of your eyes being bigger than your stomach, but like in this way. You know what I mean? Like your drive, like what you want to do and what you think you can manage is way bigger than what your actual capacity is, especially after becoming a mom. So like really having to bring it back to the bare bones. Like, what is actually important today? And maybe that is like going for a walk, and that's all you do, and you don't do the laundry, or you feed yourself, or
Exactly.
It's good.
Yeah. So bringing those things down. And then there was an analogy that I just heard about rubber balls and glass balls. So in your routine or in your life, what are the balls that you can drop and they can bounce back? And what are the balls that you will drop and they smash into a million pieces, and that's a problem, right?
Yeah.
And so identifying the glass balls and prioritizing them and saying that's where I need to focus right now. If I miss a deadline at work, it's not like I'm not going to function the next day.
Yeah.
Or I'm not going to have high blood pressure. Like they're not together. So kind of figuring again that, okay, where do I even focus and how can I try to do it all, but not what can go later, what can come now. I think to your point about the bigger eyes than the stomach is ADHD people seek dopamine, and it's a neurotransmitter. It's the pleasure chemical in our brain. And so that's why we love like shiny object syndrome. We like new things. We like things that are interesting because we get that dopamine, and that makes our brain work better. And so this is kind of that same idea of, oh, I want to start this new project, or, oh, I want to start this new journal. And then you don't stick with it because, okay, that dopamine rush is done.
Yeah.
Right.
Yeah.
And so figuring out within your daily routine, like how can you get a dopamine hit early? Like if taking a walk is going to be your dopamine hit, awesome, stick with it. Take your to-do list, drill it down as far as you can until you know what that first step is. Check that off. And now what's the next step? Check.
Yeah.
Ooh, checklist. Checking things off a checklist.
Oh, that feels so good.
Dopamine.
Sometimes
right?
I do things and just write them so I could check it off. If I do
Shower
a task I wasn't planning, you got to do it. Yeah.
Yeah, exactly.
It's so funny, but like some of the things I can totally relate to.
Yeah.
But everything you guys are talking about, I'm just like, wow, being a mom and having ADHD would be
exhausting.
So hard. I know being a mom is hard. Like there's so many different challenges, but it just adds an extra layer. And I come back to this whole piece of I just want everyone to go and get help and to, talk to their doctor if they're recognizing some of these things, because just knowing and having some validation of, oh, I'm not just a bad mom. Yeah. I'm not just going crazy that I can't stick to these things. And just having that validation that like, okay, your brain just works a bit differently. Like how can we move forward? How can we help you with this? Whether or not that's medication. And I know a friend of mine was just recently diagnosed and she's kind of on the fence if she wants to use medication, and she's like, I know me and I love the me that I am and I don't want to take away from that. And she's having kind of that, I don't want to change who I am because I love who I am, but I also want to function better. Like it's a lot, right? But I think that there's something to just being diagnosed and being like, okay, this makes things like make a bit more sense. You get that validation. And then you can start to kind of move forward and
like live more authentically as you.
Yes.
Like actually embracing yourself and your brain and the way that you show up in the world as you, instead of masking and trying to fit into the mold of everything else, because it's actually way more freeing when you can just acknowledge, okay, I can't go into a room. If my hubby and I are doing something and I need something from upstairs, I often will be like, I need you to go upstairs and get that, because I can't go into a room that I know has like exciting unfinished tasks, because I will want to then all of a sudden make the bed and vacuum. I love vacuuming. If I see like a clump of dirt somewhere, I'm like, the dopamine of that, like, of the vacuum is, I've never been happier. So one of the modifications I've had to do is I have to get my husband to like, go into the other room to get things, because if we're doing something, we're building furniture and I'm like, oh, we need a measuring tape. Like I can't go get it because I won't return back. And
you'll see it 3 hours later. Without the measuring tape.
For sure. Oh yeah. I'll be upstairs, scrubbing the floors, and he'll come up and he's like, what are you doing? And then we fight because he's annoyed. I'm annoyed that he can't understand I'm doing something brilliant right now.
I remember a day that we were podcasting and Karlee went upstairs to get something. This is so funny because I don't know, like 10, 15 minutes later, I found her scrubbing a toilet. And I was like, what? I don't even remember what you went to do, but you went upstairs for something. And I'm like, how did you get to scrubbing a toilet? That wouldn't even be on my, like if I went and saw the toilet was kind of dirty, I could be like, oh, I'll clean that later. Like that wouldn't be, I wouldn't second guess. That would just be like, oh, it's dirty, whatever.
Everything is urgent.
Yes.
Everything is
and
urgent.
then the other day we were also recording and there was like stain on my table, and I
Yeah.
guess she could see it. And so the whole time we were recording, as soon as we finished, she's like, I just need to clean this.
Yeah.
And she went,
It was before we recorded
Oh.
because I was like, otherwise I'm going to be staring at it the whole time being like, that's going to feel so good to clean. So I scrubbed it and she's like, I'm glad that I'm not, or you should be happy I'm not offended by this. I was like, oh no, this isn't about you. This is about me. Like this is, yeah.
But like, if you could just understand that,
Yeah.
like now that your husband can understand a bit, like this is actually what's going on, then he doesn't care if you ask him to constantly go in the other room. Whereas if you had no idea and he was like, why do you always ask me to do everything? It can impact your relationship too, right? It's not just about you. It's impacting your relationship with your spouse, your relationship with yourself, and also your relationship with your child. Like you want to understand yourself the best you can to be able to be the best version of you, the best version of mom, so you can have the best relationship. There's so many different layers to it.
Yeah. And just,
Yeah.
I can I'm like, we can be better friends if I can understand too how you work, and that I won't get offended
Sometimes
if you
I
go
just
and
have to
clean
scrub
something.
toilets or scrub your
Sometimes you're
table.
just going to disappear and clean toilets. I won't get offended that
or if we're talking about something and you're like, oh, and then there's this. And I'm like, nope, can't talk about that right now because I usually would be like, oh yeah, let's talk about that. And then let's talk about this and that. And then I go on all these tangents and then you're trying to go back to that first thing. And I'm like, I'm way past that. Like I can't go back to that. So I'm learning now when I'm especially working or doing anything that when other things come at me, I have to put my blinders on and be like, no, this is what I'm doing right now. If it's something I actually have to do. If I'm doing the dishes, I can't just all of a sudden go, clean that window because the sink is running. And I have to tell myself, nope, like I will do that after. And it's hard to put those blinders on because
it is.
Big shiny things are calling at me. I actually, speaking of scrubbing toilets, I was in my kitchen and I think I had just finished pumping. So I'm holding a bottle of milk and I'm pretty sure I still have the flanges like in my pumping bra. And then I'm at the sink and I don't even know how, but all of a sudden I see the cat bowl and I'm like, oh, the cat bowl, they need water. So I'm holding the bottle and I go get the cat dish and it's closest to the bathroom. So I just refill it in the bathroom. And then all of a sudden I realize the toilet is dirty. And then, or at first I think it was the sink and I'm wiping the sink and then the toilet's dirty. So I have the tap running, filling the cat bowl. It's overflowing in the sink. I'm holding the bottle of breast milk and I'm scrubbing the toilet. And I remember like catching a glimpse of myself in the mirror. Oh, I think my boobs are out. The flanges are on. And I'm like, this is different. Like this isn't what I want to say normal, but not normal. This isn't what other people do. Like this, like this, and this was before I was diagnosed. I was like, I got to look into this. This is not like this. What is happening here? And it's just the urge. Like I didn't have the executive function to be like, no, you don't need to fill the cat bowl or scrub the toilet. Just put the breast milk away, But it was, I had to do it.
I was a little afraid that you were going to pour the breast milk into the cat bowl.
That is what I thought was coming too.
And I was like, that's liquid gold.
No, none of that. And I actually Googled, can cats drink breast milk? And Google says no. So because I had a massive oversupply. So I was like, I feel like I should give them some. But no, Google said no. So
I would have laughed if I came over and you were feeding your cats breast milk. Okay, so for someone who doesn't really know anything about
Look at
this.
you bringing us back on track.
Yes. What is kind of the first step? If you're listening to this and you're like, oh, this does kind of sound like me, like, is it talking to your family doctor? If you have a therapist, is it talking to them? What are the first steps?
Either one of those. If you have a therapeutic relationship, bring it up to them. So that's kind of how I brought it up with my therapist, was just like, hey, I think this is going on. It's not her specialty, but she said, hey, there's this pretty good questionnaire that I can give you and just send it, just let me know how it goes. It was like, and so she connected me, with that's a whole different story. But yes, I started with her.
Yeah.
And then for meds, since she wasn't a prescriber, she's not a prescriber, she's a psychologist. This was also during COVID. So,
tricky.
And everything went virtual, which in the States means that federal law, you cannot prescribe stimulants unless you are being seen in person. And my prescriber had gone all virtual, and even after COVID, she didn't go back.
Oh.
And so I couldn't get an effective
that's a
med.
roadblock.
And so then I went to my PCP, and she's my son's primary care as well.
Yeah.
But I was kind of new to her as a patient, and I was like, hey, I think this is going on. So she sent me for like behavioral health neuropsych testing, which here my insurance was like, no, we're not going to pay for that. So, it's going to be $5,000 to $6,000 out of pocket.
Yeah.
And so I was like in this really bad holding pattern for quite a while.
Yeah.
And so it was just a matter of me then talking to someone who had a completely separate prescriber, but who could see in person near where I lived. And I was like, oh, okay. So I called her up, and she gave me a computer test in the office and said, yes, I think you have this. And so she saw me in person, so she's able to prescribe, and now we do everything telehealth.
Perfect.
But so you kind of come at it different ways. But I would say talking about it is number one, because I think there's a lot of, we read things online and we're like, is that me? Is that me?
Totally.
Oh, I'm totally that. I'm totally that. Right. And so there's a lot of like the self-diagnosis. So if you can talk to someone, start having that conversation within the medical or therapeutic community. So there starts being some sort of quote unquote paper trail. Because I think prescribers are very worried about oversubscribing stimulants, right? Because it's a drug that people misuse. They're going to have a paper trail. They want a paper trail. They want testing. They want, other stuff. It doesn't have to be like the grand neuropsych testing.
Yeah.
But so just getting a conversation going is a great place to start, because if they don't have the answers, they will point you to where you need to go look for them.
Yeah.
That being said, I will say that there are some really great mom with ADHD Facebook groups who kind of will say, hey, I might have this, I'm not sure, how does this sound? And someone might say it, or they might read it and just go, oh my gosh, yeah. Oh my gosh, someone gets me. And so sometimes even just doing a little bit of research that way and just kind of reading more about it, I think educating yourself is another big piece of this, and not just kind of being like, oh, I have ADHD. Well,
one Google run later, you're like, diagnosed, I have it.
Exactly. Yeah. And then at that point, you definitely can't get medication if that's what your plan is.
Yeah.
And you're not going to get the resources you need and the support you need.
Yeah.
Because you're just diagnosed yourself and no one else knows about it.
Yeah.
And so that's kind of, to your point with your friend, it is a decision, a very individual decision about medication. There are times where, women don't want to be on ADHD medication because they're breastfeeding, they're trying to get pregnant, any number of things, like they're worried about not feeling themselves. So that's kind of where I think a lot of the supportive piece comes in. That's where like coaching comes in. That's where education comes in, and discussion is kind of saying, all right, how does now that you think you have this, what do I need to do to support myself?
For sure.
And regardless of medication or not, because I think that's a very, you still have to have the skills and the systems and all that kind of stuff.
Yeah.
The medication can help though a lot with thinking clearly.
Yeah.
I think we think a lot about stimulants as, oh, they're going to make me crazy and super hyped up. But if someone has ADHD, it calms the chatter.
Yeah.
And so you're not.
It's the opposite.
Yeah. It's the opposite. And
Gets
so
rid
now
of the
you can focus, you can get more things done. So it's a mix of both kind of.
Yeah.
But
both approaches.
Yeah, exactly.
I like what you said, that medication is one piece. I heard somebody say, I think it might have been Katie Weber in her ADHD and Women podcast. I think it was her or guest that said pills aren't skills. And I'm like, I love that, because you need the life skills, and medication can be one part of it, but it's not everything, because it's not gonna fix, in air quotes, all of your problems. It's not going to. It can maybe help you focus a little bit more and feel a little bit less noisy inside, but it's not gonna it's not the solution. It's multifaceted. And I think also, like you said, about talking about it, that's so important, because people with ADHD that are undiagnosed or late diagnosed, they carry so much shame and so much like disappointment in themselves that like there's something wrong with them, that they're lazy, that they're broken, they have to fix themselves. You have to peel all those layers off to then realize, no, there's nothing wrong with me. It's just I'm different. And talking about that is so important for that grieving process, because I look back to my childhood and I grieve my childhood thinking, how much different would it have been if I had known this and had like developed knowing that my brain just worked differently. All of the struggles I had, that I could have maybe not necessarily avoided them, but they would have been different if I knew that I wasn't like inside my head. Like I didn't have to be inside my head fighting myself all the time, So I think just starting to talk about it, starting to educate yourself, listening to podcasts, reading books, and really figuring out, is this something that I identify with? Because it's a long process to get diagnosed. It's a long process to get meds. And I feel like most people who are pursuing that, it's because they feel that validation of, this is something I'm experiencing, because it's a lot of work. And then also, unfortunately, we get gaslit by medical like doctors and all the time. Like my doctor said to me, you have ADHD, like surprised, because it was my psychiatrist who had diagnosed me and started me on meds. And then my family doctor who I was seeing to continue the meds. And he's like, oh, you have ADHD, but like you have 2 degrees. You've been so successful. And I was like, it's not without great struggle and difficulty. And he actually was like, that I don't want you to struggle. You shouldn't have to struggle. And I was like, thank you. And then I think he realized like, oh, just because on paper everything like I look like a superstar doesn't mean that I'm not struggling. And I think for people thinking, oh, is this me? Do I have ADHD? I think just normalizing that you can be a very successful person in various parts of your life and still have a brain that works differently.
Exactly.
We gaslight ourselves out of it. Do you know what I mean? Like, yeah. And we're also like, they're embarrassed. And it doesn't mean you can't be successful. It doesn't mean you can't go on and do great things. You can't be a, in air quotes, normal person. You can be. We're living amongst everybody and nobody else knows, you know? And look at you, you're a doctor. I'm a nurse. I have 2 degrees and you know, it just made things a lot harder to get here, but I got here.
Exactly.
Scrappy.
It's not that we're not smart. It's just that it's hard for us to learn.
For sure.
In a very neurotypical way.
For sure.
And I actually had someone telling me, it was a couple weeks ago, that her PCP told her that she can't have ADHD because she made it through childhood without it.
Oh, gosh.
And going back to gaslighting. And
yeah.
being like,
yeah. That.
First of all, very uneducated.
Yes.
Secondly,
very old school.
Like just very old school. And and just like, and this happens unfortunately a lot in our medical community, but we also hold our medical people up to this like, oh, they know everything. So there's a piece of that too. But yeah, we spend so many years without the supports that we need. To your point, you grieving your past and kind of saying, oh my gosh, if I had just known, and maybe things wouldn't have gone any different, but you would have understood, you would have had supports. And I did have a client once tell me, she's like, I was diagnosed after my son was born. So I'm fairly new diagnosed, but I missed orientation. Right? Like as an adult, you miss all of those supports kind of coming in and being layered on as you grow older and learn different, strategies and tools and come through these different levels. It's kind of like, oh, you have ADHD, here's some meds, good luck.
Bye.
Bye. Right. And there's no, okay, so where do I start? What does that mean?
Where do we go from here? Yeah.
Right. Exactly. It's like, here's a prescription but like kind of like the skills, not pills kind of thing. It's like, think about high blood pressure. You can't just give someone a high blood pressure medication and have no lifestyle supports.
For sure. Yeah. It's one part of it. Yeah.
Right. Exactly.
Somebody with diabetes, just give them insulin without managing their lifestyle as well. Yeah.
Right. Same idea.
Yeah, for sure.
Yeah.
But people think differently about the brain and us neurodivergent people. But one of the things that we like to ask people on the podcast, so we think it's important to be friendly to all moms, but the mom that it's the most important to be friendly to is yourself. So what are some ways that you practice self-compassion as a mom with ADHD? And what are some ways that you are friendly to yourself now?
I laugh at myself a lot.
That's good.
Instead of criticizing, I kind of go, oh, whoa, brain, that was weird. So I do a lot of that, where I just have to be like, oh, like I'll tell my husband, I was like, oh my God, I had such an ADHD moment today. I can't even start to explain. And like the other day, like I told my husband, I texted him, I was like, do you know where can I tell you where my keys are? Are they in the front door? I was like, no, I know that you love me so much that you know that.
Yeah.
That's what I do. But I had left them at the beach house because I didn't drive. I didn't drive home, but my keys were there. Yeah. Right. And so it was like something like that. I could
for sure
beat myself up about it and be like, oh, it was so stupid. Why the heck did you do that? You know better.
Yeah.
But I just had to be like, are you kidding me?
Yeah.
Right. And so I think there's a lot of that, just humor, being gentle.
Humor.
Yes.
I think also like finding things to make your life easier. So like for me, I spent a ton of time looking for my phone because I had this like cute little case on it. And if I put it on the granite countertop, it would disappear. Or if it was in my purse, I couldn't see it. And so the next time I bought a phone, bright red.
Yeah.
Right. And so it's little things like that I know myself. So it's not cute, but I can find it in my purse and I can find it anywhere in the house and I've yet to lose it.
Yeah.
Smart. Yeah.
But it sounds like you're just, you're embracing how your brain works and how you are
instead of being ashamed of it, or I don't want a red phone case because then someone might know, or I might have to explain it, or I feel like people might talk themselves out of that, but it sounds like you're just embracing who you are.
For sure.
Yeah, and I think just finding ways to make your life easier, like how can we make things easier? And whether you have ADHD or not, like as moms, like how can we make things easier?
Yeah.
We do a lot, we struggle a lot. And so if there are these little tiny things that I go, oh, you know what, that would be really helpful. And that would really help my future me.
Yeah.
I'm going to do it. Right.
Yeah.
So I think both compassion and laughter in the moment, but also taking care of your future self and saying, hey, I'm going to be the parent, the provider to my future self that I didn't have.
Yeah.
I love that.
Growing up. Right. And so how can I take care of myself in ways that don't necessarily take a ton of time away from my kid or work or whatever.
Yeah. I love to thank yesterday Karlee all the time. Like I'll lay out my clothes for the next day the night before, because then I don't have to think, I don't have to try stuff on. I know it's ironed and clean, and I hang it there, and I always think, oh, thank you yesterday Karlee for this, what a gift. And then I always walk downstairs with my clothes butt naked, and my hubby's always like, you're naked again. I'm like, I know, because I have to get out of the room that I have all of these things that I can do down to a spot where I can be supervised. So I can all the time, it's like a daily joke that it happens. And because I realize when I stay up there and get dressed, I get distracted, and I take my meds in the morning, they haven't kicked in yet, so I literally get my clothes and I just go downstairs butt naked, and it's funny, and you know what, it works.
But you laugh at it, and
we laugh
Jeff,
at
like
it.
you,
We
you and
think
your
it's
hubby laugh, and
hilarious.
you just it is what it is.
Yeah,
and you take care of yourself. I remember my mom always used to make us put our clothes out the night before, and it's probably because we didn't want to have to make all those decisions in the morning when you're trying to get out the door, and so it's a good thing to do.
for sure. Yeah, doing the night before stuff. I've like fully embraced, like I do lunches the night before, everything. I pack my bag, I put it at the door. I even set the coffee. Like everything is done the night before, because I've learned from my early 20s and teens that otherwise, when I can't sleep because I'm thinking about it, and two, my morning is just like an explosive nightmare of rage because I can't do all of the things that I want to do in the like short time I've given myself. And that kind of goes to the time blindness that like I'm like, oh, of course I can do 25 tasks in 15 minutes in the morning, but like realistically, like that's a no.
Yeah.
So I like that. Yeah, being kind with yourself, gentle with yourself, laughing at things, and then also like acknowledging the little ADHD things that actually really help your life. Like the other day, I rage cleaned my whole house for like in like 45 minutes. I like hyper focused, cleaned the bathroom, I scrubbed the shower, and I'm like, thank you ADHD for that perfect gift, because now I have a clean like shower doors that haven't been cleaned ever. So
exactly. Yeah. And kind of figuring out, I think a lot of times we think about ADHD as like this bad thing, this burden, this whatever, but it is responsible for so many things. Like we're creative, we're energetic, we're really good problem solvers. We are we're very resilient. We can, do a lot, and we might not have all the same level of energy all the time. Yeah. But, a lot of entrepreneurs have ADHD because we want to be doing something different. We want to do something creative. We want to be using our brain. And the nice thing is you can then create a routine that works for your brain.
For sure.
Like for me as a PT, when I had to see patients back to back, like my brain didn't have time to do documentation or anything. And now I have total control over, how often I see people, and, and
where you do
just
things.
Works better for my brain because I was able to find that that's what my brain needs.
For sure.
Yeah, focus on all the strengths of what ADHD brings to your life, as opposed to focusing on all of the challenges because that's depressing, honestly. Like anything, it's not just ADHD, but let's focus on our strengths and what can this do? And it just...
Definitely. We spend enough time beating ourselves up.
Right? I know, yes.
So much. Like acknowledge the challenges and why they exist, but then focus on the strengths, and then laugh about the things we can't change.
Yeah.
Like my obsession with cleaning toilets while I'm holding bottles.
And being naked.
And be naked, yes. I am the naked neighbor. Yes. I am. So why don't you tell people where they can find you? Because you do have your own ADHD coaching programs, right?
I do. Yep. Yeah. I am an ADHD coach. So you can find me. My website is annaburnswellness.com. And it's Anna Burns at Anna Burns Wellness on Instagram. I have a couple of free, there's a time management download. There's a meal planning for ADHD moms.
Love that.
Guide that are both free on the website. So if you go there and go to the resources tab, you can download those. They're free. I want everybody to help wherever they can.
Yeah,
so
we'll link these in the show notes too. So if you're listening, you can go to the show notes and you'll be able to just link to the website and her Instagram, so you'll be able to find these things easily.
That'd be great.
Yeah,
perfect.
Thank you so much for coming on. It was
you are so
I learned
welcome.
a lot. Like it was
I know. It was kind of like
it's
the
fun
universe.
to talk to someone who doesn't know much about it and also someone who's living it.
Yeah,
right?
that's
I
true.
feel like that's an awesome conversation.
Yeah,
but it's also good. Like it's good for me to also learn.
Yeah,
it's not just important. Like the educational piece isn't just about someone who's diagnosed with it. It's about everyone learning how it works, because in this world, there's a lot of people who live with ADHD, and it's honestly very ignorant to me that I don't know anything.
It's just never been your experience. So
yeah, but there's so many people in the world that have it. Like, it makes me happier to understand it a bit more, so that when I encounter people and they tell me they have ADHD, I can understand it and I can know better, and it can strengthen friendships. It can just
for sure.
There's so much of a positive when all parties try to understand things, right? Not just someone who's experiencing it.
Definitely.
So I think that it's great to be able to learn more as well as someone who doesn't.
So glad.
Yeah.
Good.
Yes. So thank you so much. And we'll let you get back to your family vacation. Good luck.
I'm enjoying the quiet.
Yeah, you're like, this is great.
I might just stay here for a while.
Yeah. Be like, wow, it was a really long interview. Hours pass.
Yeah. Okay. Thank you so much, Dr. Anna. Have a good day.
You too.
Bye.
Bye-bye.